Right. Hi, everyone, and welcome back to our podcast of Sin Dieta. Before we go ahead and get started, a quick disclaimer. As a reminder, this podcast is for informational purposes only and does not constitute medical, nutritional, legal, or any other professional advice. So the content is not intended to replace professional advice, and it is recommended that you seek advice from a qualified professional if you have any concerns. Listener discretion is advised for younger listeners. The views and opinions expressed are those of the hosts and guests and do not reflect those of any employer, organization, or sponsor. All right, y'all. So we are back to our case study, right? And this one just kind of to set the tone, it really focuses back on the first 3 months of treatment, right? So we're focusing on that, the first 3 months, and definitely kind of want to get into maybe some of the themes that are typically spoken of around in these first 3 months. I know pretty early on in the case study, right, we identified some of our themes centering around food insecurity, routine building with like food intake, right, and support systems. So, just to kind of tip us off, is there any other theme that we are kind of looking for or maybe wanting to kind of bring forward?
I can start because I feel like I did it last time, kind of like, well, the
Yeah.
medical, it's going to change. It's more spaced out now, right? Like, let's say by 3 months, we've been checking in with the medical provider, like myself, once a month. Lab work, I know for this case scenario, we were checking it pretty regularly at the start because we were concerned about abnormalities that were coming reflective of when the client was restricting versus when they were not restricting. So by this point, my hope is that things have been stable. And so we could space out those types of lab works because that is a lot. You also have to consider just someone's ability with their life and day to day and costs and all of that while making sure that the patient is safe, of course, too. But hopefully, I think for this client, I know by this point we kept it to just once a month for blood work. And if by a few months out it's still stable, then we can make it even less frequent. But lab work is still very important, just not as often at this certain phase for folks in recovery. Obviously, we would bounce back to more frequent visits if there are abnormalities too, to get a little bit more regular context of what's going on with the week to week versus month to month with eating and if there's symptoms, vital signs per visit. And then whether it's myself or someone like a psychiatrist, we do like to check in at least every month for the start with medications if they are taking an SSRI. So that's kind of very typical first class meds that folks take, like Prozac, Zoloft. Lot to say behind that with meds. That could be a whole nother podcast topic, but really this depends if this client is doing okay nutritionally, because nutrition plays a huge role in how effective a medication like that is going to be. So checking in if that's helping at all. Is this the right medication? Do we just keep it at that and keep focusing on nutrition, the therapy, the community support? And then, of course, notifying the team, you all, if there are some ongoing concerns or challenges that come up and down. I think by this point, if it's myself being a specialist, I would still want to be involved, just less frequently, but I think still touching base with the outside primary care provider so they know how things have been by this point. Because sometimes we do talk about where someone might be ready to transition to just seeing their primary care provider if they know how to support this client. So those are kind of the theme points, is the same but spaced out, check-ins with some things that maybe we're hoping has been built up in supporting them, like medications or maybe symptom management, maybe hoping to see that their gut issues maybe have gotten better too. And all of this is in tie with context, right? How is your life? How is your day-to-day? How's work? How are the therapies, dietary supports, and collaborating as usual with you all. So I'll leave it at that for now, but let me know if you all have questions or I'll add in more later.
Thanks,
Yeah.
Nico.
Yeah.
I was gonna say, when you're talking about, like, this could be a whole separate podcast, and it can definitely,
Yes.
but I'm curious too, like, because I think this can easily apply to like a lot of different cases. What you do from your perspective when, like, we get a client that is struggling with the medication because
Mm.
of the side effects, right? And a lot of it, the first thing that comes to mind is like, I hear the, I don't want to take this because it's going to increase my appetite or it's going to
Mm.
change my weight. And I'm like, of course we'll try to do the whole like um restating, hey, this is for your own good. Like, let's talk about the fears. But when they bring that to you, like, how does that end up playing out?
Yeah. I mean, because I know folks, it's word of mouth or Dr. Google, and they're going to see, like, what are the side effects for this? And I
Mm-hmm.
mean, especially for someone struggling with an eating disorder specifically, there really isn't evidence of medications causing weight gain. There are even meds that's not the class of like the standard anxiety meds, like they're called atypical antipsychotics that one would think that they would cause weight gain if you looked it up, if you are taking it a higher dose and chronically for a long time for other conditions, not eating disorder. But even for that, there's not a lot of evidence of it actually leading to weight gain for folks struggling with maybe restrictive types of behaviors. So I share with them what typically happens when people say it makes me gain weight or it makes me lose weight or it doesn't impact me is really considering about the emotional state that it has helped that person get to, maybe in more balance. And has that helped them lead to having more appetite because their depression or anxiety was making it hard for them to have an appetite? So they've gained weight because now they're actually able to feel their sensations and feel in a little bit more at peace. Is it maybe they felt like food was an emotional support for them and they felt like they ate more than they maybe needed to because of anxiety, depression. And this has helped tune that out a bit and so that they can have less food noise or hunger and just eat with what their body needs. So I kind of say that that's usually the range that then leads secondary to that, to whatever your weight will be. But there isn't a magic pill that's just going to, I mean, maybe this is a very silly, literal way to take it. Like, you're not taking a pill that is just going to dissolve and all of a sudden turn into weight, fat, muscle, like that's just distributing, right? That's not how it works. And so I kind of, depending on the gaze I get from their engagement of how much they want to know, those are kind of things I'll share with them. But even with meds that are intentionally there to help maybe increase some interest in eating, because right now they're so malnourished that they just don't have that signal going on. It's not a guarantee. It's just to help them do the work that they're doing. And it's really what they're going to eat that's going to change with where their weight goes. Yeah. So it's a very common question that I get too. Now, if there are other side effects, this is the other consideration is someone is very undernourished and they're having more side effects like difficulty sleeping, maybe feeling constipated, stomach pain from the meds. That is a consideration that we have to make is this med even worth it right now? Because they're not even building enough neurotransmitters even for these meds. And so they're getting more side effects than benefits. And maybe it's not a good time to be on it. So there's a lot that we consider with medications at this point in time. Yeah.
I wanna like highlight, Nico. I think just kind of going back to almost like that visual aid that you gave us, right? Of like, it's not like you take this pill and boom, like it's gonna dissolve and turn into this weight in like the body, right? But when we're looking and thinking of that, I honestly, just in my experience of working with folks with eating disorders, I that's truly what the eating disorder is
Saying.
saying,
Yeah.
right? No matter how, like for ourselves, right, where our cognition is clear, right, our mind's a little bit more clear, we're fully nourished, right? So we're thinking clearly, we're thinking logically. That, but truly, what you said is like what these folks are experiencing, right? Now, it sounds like medically, those first kind of 3 months is really physical stability, right? So
Maintaining
for this,
it. Yeah.
yeah, maintaining that. Now, you did mention like monitoring like blood work and vitals, right? Is there anything else that you would suggest, especially for our case study, right? She's a young female. Is there any maybe sort of like tracking of like her menstrual health or anything like that that you would kind of shift
Absolutely.
focus?
Yeah. I can definitely go through specifics of what I usually ask from head to toe. So I definitely ask for every client who has ovaries and uterus as the parts that leads to a period, if they are still experiencing that or if that's changed, because that also can tell us a lot of what's going on. It's not just based on weight, right? Whether we see someone is doing better or not with their nutrition. So cycle is a big one that I'll always ask. General energy level, sleep, how they're digesting. Have they had more diarrhea, constipation, bloating, the whole array of stuff, heartburn, you name it, because those things can sometimes be a new block that comes up that makes it hard for them to go through this process. Like maybe we've gotten so well up to a certain point, but now we're feeling some stuff in their stomach. What else do I ask? If we're doing labs, I'll spend time to review those results and review what it means with them if we haven't done that yet. I think it's always important for folks to know what they're getting poked for and what that indicates, rather than just saying it's normal or it's just abnormal. So just saying the specifics on how that connects with nutrition and what we're weaving into the full picture. Verifying medications. Have they been able to take it? Have they had any barriers to getting refills or with vitamins? Do you need a prescription at this point? So those are some of the basic standards. I'm trying to think what else. If there is anything outside that, even if they think is not related, but medical updates, if you started seeing a specialist for a hormonal issue or you had a recent injury, I think those are also obviously very important for us to know how to pivot, focus, support you, right, and see what's going on. So yes, periods are important, as well as a whole other array of checklists. So my follow-ups tend to be 30 minutes, but sometimes I wish they could be more so we can have more time.
I love that.
Yeah.
I like how you focus on the different like intersectionalities, right, and connections, right? If there's like access to certain medications or supplements. Now, Christina, I'm going to throw it at you for a little bit, friend. So from like a dietitian perspective, right, and working with this patient in particular, like we know that, she has reliance on SNAP benefits, right? Sounds like there's like food insecurity and some challenges there. I'm wondering, right, just kind of how that ties into the work that you would do with this patient in these first kind of 3 months.
I think being considerate of those factors in this case, I would really want to be making sure that we are establishing our sources of food. How are we utilizing them so that it's not something that's like further amplifying the scarcity, right? Like you don't have to sacrifice your portion to make sure that X, Y, and Z happens. It's more of like, how can we stretch this out so that we can build it up and make it more hardy? And I think through that is going to naturally come some like starting food challenges, whether that's like incorporating fear foods or starting to like make sure we're really honing in on the like, how are your hunger and fullness cues registering? Because that's also going to tell me a lot about how the meal is impacting you. I think we harp on physical hunger and fullness so much that we forget about the mental and emotional tie to it. And it's like, hey, we're reviewing your eating, you're telling me you had these meals, and I see variety, but like, how much of this are you actually enjoying? And why are we making these choices? So often, especially this past month, like more than usual, I get people telling me like, oh yeah, I made this choice and it was good, and this one wasn't as great. And I'm like, wait, why are we using good and bad? Like, why are we evaluating the, I guess the moral side of this food when I'm not here to grade you? Like, I just want to make sure you ate. And if you ended up using a specific part of your budget for the food, but you made the choices that were going to be like societally deemed as the best things, but you're still here thinking about other food, then what are we really doing, right? You're still going to be hungry. Your brain is still going to tell you, hey, we wanted that burrito and we made ourselves eat this sandwich or this salad. We're not really letting ourselves have that like excitement in the food when the burrito could be very well like something you enjoy, because I mean, who doesn't like a burrito? They taste good. But
Mm.
also maybe those are things that like your mom was making, and for some reason you stopped eating them because, oh, here we go with las tortillas are too many calories and carbs, but it's holding so much nourishment inside for you. Um, and really getting to like, let's not be scared of
Mhm.
what it feels like to like be full. Let's evaluate, is this fullness coming out of like a physical sensation, or have we mentally trained ourselves to say, this is where I stop? And now I'm convincing myself that I'm full.
Ooh, that is so good, Christina.
It's a lot of
Honestly,
mind work with that you're sharing, like with the actual food you're eating. It's not just a
mm,
nutritional session of like, let's do this and this, but you're also like, what was your mindset behind that? How is it after? What are these rules that this is the work, right? Like to
mhm,
break down
Mm-hmm.
that mental rule or cyclical thought, because that is
mhm,
really how it becomes easier over time to retrain the brain basically that this isn't a fear, this isn't a bad thing or good thing. So
Yeah. I'm
that
curious.
nature.
Do like, oh no, go
Go
ahead.
ahead. No, go ahead, Christina. That's fine.
Well, no, because I'm like, when I'm in this session with clients, I'm always like kind of thinking, I don't know, let's call it out of body experience. I'm hearing myself talk, and I'm trying to
Ooh,
like perceive, like I think we're very like well trained in like reading people's body language, especially in
mhm,
virtual settings where it's like, ooh, how is this landing? Is this too
mm,
much? Are they understanding? Have I lost them already? And then in trying to like make sure that I like to summarize, but I like to turn it back to them and say, hey, like, I did a lot of talking. What are you taking away from this? What are you prioritizing this
mm,
week? And it could be that I listed off 3 or 4 things, and they're like, you know what? I can only do 1 or 2 of these. And I'm like, great. You set that for yourself. I'm here to support it. And we'll see what we can tack on next time.
mhm,
And I think moving it to like to your lane, Vero, like bring this up with your therapist, because I'm
mhm.
pretty sure I made you feel a little uncomfortable, and that's okay. Like, how do you take it from there?
Yeah. And I think with just kind of tying the two, right? Like the nutritional rehabilitation aspect, like I don't think folks like realize how much like therapeutic work goes into that. Because it's honestly, especially in this field, it's all very therapeutic, even for like yourself, Nico, right? Like everything, it's really like there's a lot of therapeutic frameworks and undertones in every single um, role that we play, right? Because I've met some dietitians, if yourself included, Christina. I'm like, you're over here doing like amazing. Like this is nice. Like a good cognitive behavioral therapy over here. For this case study in particular, this phase is really about challenging that internalized messaging, right, and beliefs around like body image, worth, control. Um, Also challenging those those feelings of losing a piece of themselves, right? That is a common theme that is very much so explored, right? And that I've heard, and I'm sure we all have heard, right, kind of come out of our patients' mouths as we worked with them is like, I don't know my life without this, or I don't know, or I can't think of what I would do or how I would be without this, because it's probably been with them for so long, right? Um, some exploratory questions, because again, I know Stacy's not here. She's LMFT. My background's in social work, so I think the way that we approach it is similar but a little bit different. I definitely like to look at the family system, right, and also be able just to see who they have as their support, how their environment impacts them, like how that kind of trickles down. Because I think it might be like a Latina thing where it's like community is important, right? There's collective healing we could do that with. We have our people, our tribe, right, with us and in the process. So I think some of the ways that I do that is really exploring like what messages did you receive about food growing up, right? how you were saying, Christina, are we demonizing certain items? Are we not demonizing other food items, right? And then also, I think for this patient, seeing how she's taking on that second mom role, like I want to know, like how did her role in the family really shape her relationship with eating? Did that kind of ignite that behavior of like everybody else eats and then I eat if there's leftover, or I eat if there's even food like available, or kind of putting herself last. And then also starting some of those coping skills, which I really enjoy, is really being able to start adding to their toolbox a lot of behavioral activation, right? Helping her in specific for this case, like re-engage with life outside of the eating disorder and starting to kind of build that foundation of like, this is what life can be like without your eating disorder. Your identity is separate from the eating disorder, right? Now, I'm curious because I think like the whole like our whole time the segments that we've done, it's like this is everything that we've talked about. I think it would be like with the perfect patient, right? Like if everything was going to according to plan, but we know that recovery is not linear. I know y'all laugh because it's true, right? Recovery is not linear. So I'm wondering, right? Because these first couple months are I think they're very telling of just kind of how recovery is going to go in general for the patient, right? Like if they're showing up, if they're not showing up, if there's like heavy pushback and like the sessions, like how would we kind of maybe gauge this patient or re-engage the patient if we start noticing that they're kind of pulling back?
It's a good question because we do get that a lot, right? And it's hard because if they don't show up, we don't have the opportunity to ask. But if they do eventually, it's like, how has this been in balance with your life? Because we don't know what else is going on, right? We can only hear so much about their day to day. So are there areas that's just become louder and more important for them that they have to be there for? Has this been really hard? Like maybe the pace has been maybe faster than they even realized they were comfortable for in doing it. And that's okay. Because I think the other piece for someone struggling is, for some or a lot, I think, is having to be the perfect patient and the perfect, like the perfect client doing this perfectly and like appeasing to the providers too. And it's like, no, we can go back to step one if we have to. That happens. Like this isn't an easy thing just to easily like unzip like a nice perfect little zipper. It has its ups and downs, and we definitely know that, right? Because we work in this area. So what is it that you need right now? What is your priority? Is it to step back and say, I need to go back to some moments of restriction? Like, is it where we talk a little bit about harm reduction, right? Where they can feel safe and feel like they're being heard and we can go at a comfortable pace. Medically, that would be like, okay, that's fine. Let's figure out how we can still make sure we're supporting you to make sure you're safe if that happens again. So I don't know. I don't know if that's something you all experience. I mean, I don't think I always have a conversation to that extent because it's usually me learning from you all that this is happening. Like maybe we're slipping backwards a little or we're losing them. And so I know already what to jump in on and what to address. But yeah, that's my thinking is it happens and it's okay.
Yeah. I think for me, like, in the realistic sense of we're not always dealing with the perfect client. Like if we're 3 months in and I'm still like, hey, these logs are not complete. Like I know I keep bringing them up. That might be annoying or frustrating. Like it's probably making us feel some type of way. Like let's pause and talk about like, why aren't we doing them? Or like, do we need to be doing them? Because if this is holding us back, then let's just get rid of it and pivot, right? Like this is not the only way we can go about it. And if it's really about, like a lot of the times these things are tools that are themselves helping to challenge or reframe a behavior that has been like, what is the word? When you like steal something, it's been like hijacked by the eating disorder, right? Like so that it keeps the person in this restrictive mindset. Let's figure out how we slow down so that if you're scared of writing down and telling me everything you're eating, and I notice you only track certain things, like maybe let's just not include details right now. Let's just get into the habit of recording in general. And you let me know when we actually review together what the nitty gritty was. Okay, I see you said you had a meal here. You had a snack at this time. Or maybe you don't even label it. Meals and snacks are confusing. I ate at 5 p.m. Okay, what did you have to eat that you remember? And we break it down in real time. And then I can physically or visually now see what it is that's coming up for them. Or, outside of recording, I broken recordly tell them at the end, like, let's take a deep breath. How did that feel for you? If you ever feel like I said anything that was too much at the pace we're going, like, you need to stop and tell me. I will try to the best of my ability to slow down and point it out for us. But when I can't catch it, because you're the expert of what you're living right now, you should tell me, and I'm not going to be mad. And I try to create that collaborative environment and hopefully make it the space feel safe enough for them to be like, this is too much. And like Nico said, if restricting is what's feeling safe right now, okay. In a perfect world, I'm talking about let's eat every so often. And that might look like 5, 6+ eating opportunities throughout the day. But we're coming from a place where we've only been eating once or twice. Let's add a meal at a time. Maybe that means the next 2 to 3 weeks, you're only eating twice a day because you were eating once. And sure, that's not what we're trying to do, but you're getting a step closer than looking at the top of the mountain and thinking, how am I even going to get there?
I love that. I think that kind of ties back into like that collaboration and that alignment, right? And then also just that's just like so empowering, right? Because it serves as a reminder to our listeners and to those who may be even going through their own recovery journey of like recovery is not linear, right? It's going to look so different for everybody. Like your providers essentially ideally should meet you where you're at, right? And be able to go at a pace that's going to feel comfortable for you, but also know when to push you appropriately, right? Not physically push you, but like just kind of push you like in a way that's going to foster that recovery and the outcomes, right, that we want to see. So definitely that team collaboration and for patients, like how you said, Christina, they are the experts of what they're living, right? We're only with them at like 1 hour like a week or an hour every other week if we're lucky. And it's really a kind of like a very delicate dance, I would say.
That's where we say we're consulting here. You're here for
Yep.
a reason. You reached out for a reason, or referred to us for a reason. And then I always think like it is important. I like to ask folks, even teenagers, like they sometimes know they're like what they feel like recovery looks like for them, because the definition can also vary too. That's also not a textbook like A or B. It really varies on what healing looks like. And it's going to evolve as they keep going along and changing. But that's also important. Like, okay, right now, let's just pause on what is recovery feeling like for you? What do you foresee in the next week, the next month that feels comfortable for you right now that you want to be able to achieve? So yeah, definitely. I think I feel like we're all pretty good at sensing like when things are a little bit slow, we're not getting that momentum because that happens. And it's just having to pause and revisit what they're feeling like they're ready for, because we have no idea.
Mm-hmm. I'm curious. That made me think, Nico, with you saying that it's a consultation, like they're coming to us, we're providing advice, recommendations. Ultimately, they're going to decide what they apply or not. This might be like more so like an all of us thing, but like I look to therapy because I think a lot of the times like y'all are at the front kind of like setting the tempo of how we're progressing. And I'm curious, like, we know a lot of the clients that fall within the disordered eating space. We see like very strong type A personalities. And in that, it's like it's not uncommon for them to ask us then, like, so how does this work? Like, what are my markers of progress, right? Like, when am I supposed to achieve this? How do I know I'm succeeding or making progress? Like, how do you lay that out for them?
Mm-hmm. That is something that, yes, it is very common, and very much so something that I see at least, 3 to 4 times a week, right now. But one of the things for myself personally that I really like to do is reflection. Just kind of reflecting back on the milestones. And by that, just kind of taking it back to the example that you gave, Christina, right? Where it's like if maybe the patient was only eating like once a day and then they're eating twice a day, right? And then we're kind of building up from there. I really like to kind of reflect back every so often and just kind of remind them of where they were and also remind them of where we're going, right? So I think that really just kind of serves them of remembering like we're building this foundation for sustainability. That's something that I always remind them, right? Especially right now with, the GLP-1s and all these things, like I've had a lot of patients be like, well, why can't I just like do that? And then, you know, there's a shortcut. And then it's just kind of like, okay, but are we looking for a quick way out that's kind of just putting a band-aid on something? Or are we looking for sustainability and long-term recovery? And then they're usually like, the second one. I'm like, okay, well, that's kind of what we're going to do, right? And this is the plan. And just remembering and reminding them all the time that, recovery it looks so different. We're going to have weeks where we're right here. We're going to have moments where we're here like this, right? But it's still happening. And any of those like intervals, it's still happening. So that's really kind of how I handle it.
Mm-hmm.
I'm sure if Stacy was here, she would give us like a very beautiful explanation of how she does it because I know she's been in this field for such a long time. But really, it's really just reminding them of that we're building that foundation for that sustainable recovery that they're hoping to achieve.
Mm-hmm. No, I think that's really well said. Bringing it back to them. And I think that also is a nice reminder that, like, hey, don't forget, we're here to work on your goals. And I'm just trying to figure out how we can get you there together. So progress is going to look different. And the goals, as you kind of get closer and closer, are also going to change. Maybe we cross something off the list and now we're on to the next thing that we didn't even know we needed to or wanted to work on as a result.
Mm-hmm.
I love
Or maybe
that.
the original goal, you don't even care about that anymore, right? Maybe you're like, yeah, actually, I just fast track forward to something different. But I like that you also include like the downs are also part of healing and progress. Like that's how we learn is like with another thing I'm getting with all of this is also like what are areas that are not working well and what are we learning from that? Because I feel like we learned a lot from those areas of like discomfort, areas of blockages, of where we feel like the eating disorder is still really loud, like still present. Like that is like the meat and potatoes of everything, like of how we can know what's still going on and how it impacts them. Yeah, for sure.
I think the only thing I want to kind of add on to that is, reminding our clients, right, that resistance isn't failure. It's part of the process, right? It's going to happen. It's part of it. It's expected. I think I would be a little bit concerned if there was not resistance. Be like, what's going on, right? So just like, just to be real, like this phase is hard. It's not an easy phase, and recovery in general is a very difficult but not impossible thing to go through.
Yeah, I agree. If we're comfortable, something else is going on. When it starts to feel scary, that's when we're growing. And resistance is survival. We haven't done this. Our nervous system is activated. It's telling us to run, to like stay alive, but really like we just have to let them know like there isn't actually a physical threat here. Yeah.
I'm thinking too, because I know you said your lens, Veronica, is like the community family based first. It's like also at this point, at this phase, a few months in, are there folks who know about what you're going through, who are there to check in with you? Is there accountability that you need? Do we want to involve someone in a session to know how to help you? Like, are they making a lot of your meals and it's triggering of what they're saying? That's like when we talk about like mentorship, but that's, I'm sure, stuff that we can also involve them, their supports in to know.
Bringing it back to that collective healing, right? That community, I strongly encourage even the patients that I work with now is like, do you have anybody, right, that knows like that you're in recovery or that you're going through this? Like, how can we build, if you don't, how can we build community for you? Right? Like, are you interested in, like having or being part of like a group in person, like virtual, whatever it may be? Like, let me help you find a place where you feel like you belong, right? Because it's very isolating as it is. Having an eating disorder is very isolating. That's a lot of times that's kind of how some of these work, right? Kind of keep you away. And then healing and doing this alone is it's just even harder. So being able to do it in community, even if remembering it's going to be scary, right? Especially when we're over there trying to tell like our tias, our mom, like our primas, like our primos, like what we're going through, they're probably gonna be like, what? But and not understand. But remembering that we have to give them grace and allow them and give them permission and the opportunity to be able to tap into who you're working with, right? To be able to learn, grow, and really be someone to support you. Right? We're trying to minimize stigmas. So that's really how I would recommend kind of going about it.
Yeah.
Right.
I think it becomes a really nice invitation for everybody to learn and grow together. And so that they can learn about what things maybe we shouldn't be saying the way we have been. And I think to me, my mind always goes back to this, the biggest thing I've learned is the impact versus intent. Maybe they don't mean it that way, but it very much caused real harm. And how do we learn to do it differently? Not because we're bad, but because we just didn't know. And we kind of like are able to, and that's like with anybody, like you were saying, maybe they need support groups, or like if it's not a direct family member, is there a close friend or somebody else that we want to make sure like this person makes us feel safe. And I think depending on how the relationship is, they could also help me by learning what my triggers are, what ways to like encourage me that don't feel like they're minimizing my experience.
Or even who are people in my community who maybe I see has a healthy relationship with food, who I want to eat with, and then just like sit with and observe and have that direct interaction or influence. I was also going to say for this case, kind of like reeling back towards the cases, I don't know if we included this, but I know if I remember for a family member, it was her mother specifically who also struggled with body image, maybe some disordered eating types of behaviors. So it's also kind of, if we were to include a family member, like they may learn themselves like, oh shoot, I guess I had an eating disorder or have one now. Let's heal together. Let's go through this together. And I feel like that can be very empowering too as a family, and to realize like there's no fault. This is what's happened intergenerationally that we can work through and see. So that would be a suggestion, is maybe checking in, like, how are things with who you live with right now and how they're doing with their eating, and do you want to involve them?
I love that, Nico. Again, taking it back to the intersectionality and just kind of like the layers, right? There's so many complex layers for both like marginalized communities and for non-marginalized communities, right? There's a lot of different layers and intersections that do play a role, right? And how we learn our eating habits, or the way that we learn, right? Or have access to stuff. Systematic barriers is where my mind goes to. But as we kind of come to, a close of our episode, is there any final thoughts that we have or that we want to share before we wrap up?
I think I'll say that like this stage can a lot of the times feel repetitive if we are struggling to take that next step. But this is where you kind of have the opportunity to vent and get it, wrong as many times as you need to. Because once you move on, like you're gonna look back and be like, oh, what was that thing that was making me feel this type of way, right? And if it takes 5 times, so be it. If it takes once, great. But Vero, like it's not linear, right? Like everybody is going to face their own challenges in different ways, and some people might need to do them over and over. And there is no like deadline for any stage that we ever are in. It takes as long as it needs to, and you get there on your own time.
Mm-hmm.
I'll add, this is the point where have been building a relationship with the client. And so establishing or reminding them like that we want feedback too. Every process is different. We're here for you. I like what you said, Christina, with everything. Like I may not always catch it or be able to phrase that outwards, like of what maybe we need a shift. So if that's missed or if I miss something, please let me know. So it's just continuing to feed that safe space for them to know that this is an equal thing. This is not a me telling you what to do kind of situation. And that way they can still know, like, even if it's repetitive, even if they're frustrated or feel like they're not doing it right, that this is fine. We're still here for you and continuing on.
Beautifully said. All right. Thank you all for joining us. And in our next episode, we'll continue exploring recovery for this patient, and we'll go there shortly. Thank you.
Soon. Yeah.
Yes.